Kauthar is 6, and this tiny courtyard is almost her entire world. Since her kidneys started failing, her parents haven't allowed her to play outside. She doesn't go to school either. Her unemployed father says the injections she needs just aren't available here.
She's 6 years old. In a year, she should be entering school. But how can I put her in school? I should treat her first. She's in pain.
So Kauthar watches cartoons most of the day. When the hospital couldn't help, her parents took her to the holy shrines to pray for a cure.
We're asking the Prophet's family to intercede for us in heaven and heal her.
At the main children's hospital in Baghdad, a stream of parents and children arrive from all over the country to be treated. Before the war, this hospital lacked almost everything: medicine, basic supplies. Iraq blamed it on trade sanctions. The West blamed it on Saddam Hussein. But whoever was to blame, by the most conservative estimates, thousands of children died because of it. The healthcare here is a lot better now, but 8 years after Saddam was toppled, there are still serious problems. The violence has left Iraq with a severe shortage of doctors and nurses, particularly outside Baghdad. This hospital is so overcrowded, sometimes the children sleep 2 or 3 to a bed. And there's a huge problem with medicine. This is counterfeit and expired medicine seized from pharmacies by the health ministry. The government is discussing having UNICEF buy medicine for it to make sure there's a reliable supply. Sayeda Abada came from Mahmoudiyah, south of Baghdad, with her 2-year-old grandson. He hasn't been able to eat or drink for a week. They gave him IV fluids and an injection, but it's in the hands of God, she says. In Iraq, 41 out of every 1,000 children die before they turn 5. Iraq is trying to cut that figure in half in the next 4 years. These children are fighting against those odds for every breath they can get. Jane Arraf, Al Jazeera, Baghdad.